Today, we are going to talk about immunity because dry fasting is, to my knowledge, the best chance of healing for all autoimmune diseases. So today we will detail this in a video discussing autoimmunity in general. Before that, the dry fasting retreat lasts 2 months in Montenegro. It's the second to last retreat of the year. We have one more date in Colombia for Americans, but it's the last retreat in Europe this year by the seaside. So it might be the last year we go to Montenegro, making it a truly beautiful place by the sea. Still with prices that are affordable. It's not a hotel, so it remains reasonable, and the place is nice. A little bit like the Slavic countries, we have a bit of Russia in us, but it's not quite the same. It still remains very European. Touristy, although at this time of the year, late September to early October, it's not too touristy, so the beaches are not too crowded yet, and well, I'm looking forward to it. It will pass quickly in any case in 2 months, so there are still a few spots left for those who are interested. We have groups that don't exceed 25 people, so we can't go beyond that. There will be 3 coaches in total, so we will always have the same workshops. This year we've really focused on the armor release workshop, which is truly an amazing workshop, which brings something even more. And then Hedi's contribution in coaching, we really have. There you go, we are really now a team. It's starting to get well organized in the care and support. It's becoming more and more enjoyable, and then with effects that are really interesting. In any case, I am always very surprised but amazed every time by what we manage to do, by what happens in these retreats. There was a lot of human warmth. It's very beautiful to observe in any case. And I tell myself, even I who wants to do dry fasting don't know where to go, so I have to do it alone. And it's true that the community aspect of doing it in a group, in a structure where you have nothing to think about, nothing to reflect on, nothing to do, is missing. It really allows you to delve even deeper into your fast with things happening inside. So that's why now we have many people who return as a kind of ritual, a preventive treatment, a self-regeneration cure every year, and in any case it's a pleasure to see. There were 8 people returning, so it was interesting to see people coming back, and then it also allows them to refine and see the details, to know exactly what they need each year. And it's true that if you don't have someone coaching you on this, you're kind of navigating blindly, not knowing exactly what kind of dry fasting days they would want. With our experience, we can tell exactly where people have reached their limit so as not to exceed their adaptive capacity. Because if you go beyond a certain stage of dry fasting, you go too far, and then fasting becomes counterproductive. You're no longer in the law of hormesis, and you won't reap the benefits of your treatment, but rather be in energy recovery because you've gone too far. That's why we always say to a company, well, it's clear that it's a cost, but you still have things that have been thought out and are there for you, making it much easier and more comfortable when you're in a structure. So that's it for Montenegro. As for the immune system, I would say it's truly a powerful therapy, regardless of the autoimmune condition one might have. We now have many autoimmune diseases affecting a lot of people, and dry fasting really provides an answer through 3 mechanisms: autophagy, anti-inflammation, and resting the immune system via the gut. These are the 3 key mechanisms, along with detoxification, which we could also include. And we could also mention stress management, because dry fasting brings about a mental calmness, When you undergo a cure, you truly experience a kind of calmness that is present, where you really have something that has rested inside you, allowing you to regain a great deal of self-confidence and to know where you want to go. In short, the immune system, so it's an autoimmune disease. So what is an autoimmune disease? So it's one's own immune system that will attack its own body, attacking its own cells and tissues. Our immune system no longer recognizes what is self and what is not, so it will attack areas within the body. Notably, it will attack through the intestine, so it leaks. It's a pathway, a possibility for them. And well, we have antigens, bacteria, parasites, things that pass through and will attack very specific areas like the joints, polyarthritis, lupus erythematosus, Hashimoto's thyroiditis. It will attack glands, it can attack the intestine. Therefore, destroy an intestine, inflame the intestine, Crohn's disease, ulcerative colitis. It can attack the brain. In the case of multiple sclerosis, one could even extrapolate to Alzheimer's, Parkinson's. So in these pathologies, we have the advantage, in addition to the immune protection mechanisms, we have BDNF, the neurotrophic factor. You will create new nerve connections, so you will increase your synapses, your nerve connections will improve via BDNF, the neurotrophic factor, where you have an improvement via ketone bodies, via BDNF, which will occur at the cerebral level. You have there everything related to skin problems like psoriasis, vitiligo, all these skin diseases. Dry fasting is spectacular. Whether you have any skin disease, pimples, acne, whatever you want, any kind of suppurations, pus coming out, I don't know what you have on your skin, fatty lumps, whatever you want. Dry fasting will dissolve these intruders. They are toxins that the body, and with autophagy, it will autophagize them, meaning it will self-consume them. So it will feed on these growths to provide nourishment to the body, creating ketone bodies. So it's autophagy. It's the ketone bodies that will use these supplements to recycle and create new ones. Tissues. So the causes of autoimmune diseases are multifactorial. Of course, we have causes like stress, and if you have a lousy lifestyle, you don't sleep, you eat anything, your lifestyle is not there, well, there you go. I always say it only takes 2 triggering factors to start a pathology. Imagine an elderly smoker. He has smoked 3 packs of cigarettes his entire life. It's just a metaphor. He is not stressed. He eats well. Everything is going well in his life, and yet he will develop lung cancer. On the other hand, if you stress this same person, give them a very violent emotional shock, like burning their house down or something serious happening to them, an accident, losing someone dear, etc., you have a second triggering phenomenon, and then the pathology starts. There are always 2 triggering elements, so it's always important to have the best possible immune system. Fasting helps with this prevention by maintaining good immunity, because you recycle, clean out waste and toxins as you go, and engage in autophagy, ensuring your immune system is always functioning well. This means that if you cut yourself or step on a rusty nail and suspect tetanus, the immune system can handle it. But if your immune system is fragile, if your lifestyle is a bit lacking, or if something is not right in your life, if you're a bit at odds with life, then you have a second element, and the pathology starts because the immune system can't do its job. So you have intestinal permeability, as I mentioned earlier, leaky gut, which is a scourge not studied in medicine. Doctors talk to you about intestinal syndrome, but they don't really know what it is. If you mention zonulin, the marker of intestinal permeability, they don't really know what that is either. Zonulin doesn't mean much to them. They didn't learn about it in medical school. Only functional medicine doctors are familiar with these subtleties. Viral, bacterial, parasitic, and ancient terrestrial loads can all lead to immune problems. Toxins, oxidative stress, and deficiencies. Chronic inflammation can all lead to immune disorders. So, you see, an autoimmune disease is never just one element. It's several elements together, as I said. Two overlapping elements cause problems to arise. So, dry fasting has an answer to all this through several mechanisms. Firstly, there's accelerated autophagy. Dry fasting is the #1 therapy for autophagy, far ahead of sports. In fact, physical exercise is good, but you don't achieve the same level of autophagy by exercising as you do with a 6 to 7 day dry fast. It's not the same thing. In terms of ketone bodies, you have a certain number when you exercise, but you don't have them when you dry fast. So even the ketogenic origin of ketone bodies is 3 to 4 times lower than with dry fasting if we compare. Thus, the mechanisms of autophagy will lead to recycling what is excess in the body, what is an outgrowth, what is unnatural, what is dysfunctional, a dysfunctional cell, a misfolded protein in the body, debris from bacteria or viruses, a toxic product, whatever it may be. Autophagy will use that, recycle it, and then create new tissues from the old. That's the key principle of autophagy. And then the more you push your body to its limits, the more proportional the response will be. This means that the dry fasting is the most advanced type of fasting. So the more stress you impose, the more the body will respond with a reaction. Adaptive to the stress you impose on it. Therefore, the more you subject yourself to depth within the body that will go recycle, who will go to get food, who will go to get debris to make food, who will go to get water, the more you submit this stress, the more the response behind will be to correct, to repair, which means that dry fasting will repair at least for a month after breaking the fast. It is for this reason that the reintroduction of food is key. There you go. So point 1, autophagy, which will force the body to destroy weak, dysfunctional or intoxicated cells, including old inflammatory or poorly regulated immune cells. These are the T lymphocytes. They are the ones who are involved in this phenomenon, the autoreactive T lymphocytes that attack the body's tissues in autoimmune diseases, so they are regulated or eliminated. So there you have it. Autophagy is a key principle of fasting, and particularly dry fasting, where we will recycle everything that is external, dysfunctional, and doesn't belong there. It will be reused to create new material. So that's the basic principle of dry fasting. Then reprogramming of the reader system. So this is what we call T lymphocytes, which will reduce their aggressiveness. So what we call Th1 and Th17. If you see a functional doctor, they will perform tests known as lymphocyte typing, and you will see all these types of lymphocytes rising and falling. In autoimmune diseases, it's mainly Th1 and Th17 that increase, and you need to balance Th1 and Th2, but especially ensure that Th17 doesn't rise. Traditional doctors aren't familiar with this. It's functional doctors or somewhat avant-garde naturopaths who know a bit about it. So what does dry fasting do? It reduces this notorious Th17, bringing it down, which means it truly has a genuinely autoimmune regulating aspect, as we would say. So it is a regulator of immunity, which is what we call immunomodulation. The principle of dry fasting is an immunomodulation of immunity. Then it will promote regulatory T cells that will soothe pro-inflammatory cytokines, thus reducing IL-6 cytokines, pro-inflammatory cytokines, TNF-alpha and IF-INF. All of this will be drastically reduced by dry fasting, leading to less cellular destruction and fewer flare-ups, with an immune system that learns to tolerate more easily. Therefore, we have an immune reprogramming system through dry fasting. Thirdly, dry fasting induces a decrease in the intensity of pro-inflammatory macrophage activity, known as M1, and also promotes M2 macrophages, which are reparative and anti-inflammatory. Hence, markers like ultrasensitive CRP, IL, IL-1 and prostaglandins decrease, particularly what we call pro-inflammatory cytokines and pro-inflammatory prostaglandins. Additionally, we have factors like CRP, well known for inflammatory diseases, and it's also the ultrasensitive CRP that needs to be requested in the analysis, which indicates low-grade inflammation. Therefore, dry fasting is excellent for significant inflammation, but also for low-grade inflammations. Noise. Here is point 4. Repairing the intestine is almost the key. It's the leaky gut. So the permeability of the intestine is induced by junk food, dietary disorders, overly industrialized and sugary foods, bacteria, pathogens, poor assimilation, impossible nutritional combinations. All of this leads to intestinal permeability. Heavy metals, overly acidic foods, gluten and dairy products in particular, all contribute to intestinal perforation. This is well documented and validated. That's why when you remove gluten and dairy, you know you can easily improve permeability in someone, and then the intestine can heal itself. But the best remedy for permeability is really rest. We have people who come to the office tired, and I tell them they need to fast. There's no more assimilation. You can take all the dietary supplements in the world, but if you don't assimilate anything, it's useless. So dry fasting is the best way to give the digestive system complete rest, so afterward you can re-assimilate all the vitamins and micronutrients you want, and you'll recover and your energy will rise again. So this has been well evaluated on anemic individuals. A fasting cure, and there you go, you're no longer anemic. A redistribution occurs, everything is better assimilated. As soon as you eat meat, well, there you go, you can use the iron, everything is better absorbed. You have a system that is renewed like a baby's in terms of digestion. You can digest nails, it works very, very well as long as the recovery is done correctly. So there you have it, and all the solutions are in the book on how to resume a dry fast. You have leads and solutions in the book. So then the permeability of the intestine is put to rest. I don't know if that's the only type of day you have complete rest, because even with water fasting, the water you take into your body has to be processed. So your digestive system is never at rest. It's always working, which means less vital energy during fasting. And if you walk too much or do too many physical activities, there's not enough energy left for detoxification and cellular renewal, the renewal of organs. You have less juice. So that's why dry fasting, of course, might be more taxing in a certain sense, but you truly have a rest that can be called completely total. And then I would also say that in dry fasting one must have a lot of humility in general, because we still don't know everything, and we must remain very, very modest in any case. Among all the people we see arriving at the treatments, of course, we refine ourselves, we start to improve, we begin to understand better, but dry fasting is currently in the world, which is a therapy, I remind you, that is a patent filed in Russia in 1992, which was aptly named the system of rehabilitation and reconditioning of a human being. So it was conceived by Dr. Chenikov at the time as a system for regulating and restoring a human being. There you go. One must remain modest because there have been very few studies on dry fasting. We know very, very little. Of course, I can see the plans and the enormous potential of this therapy. We should have clinics, as I've said several times, dry fasting clinics all over the world. Doctors should be interested in this, especially in pain management, inflammation, and inflammatory diseases. Rather than giving cortisone, you provide a service with dry fasting, monitor the patients, and you can clearly see their inflammatory markers decrease day by day. It's obvious, yet no one is interested in this. There should be doctors creating clinics. You have so many effects that are much more spectacular than cortisone, which poisons the liver and intestines. Dry fasting is natural, and you treat inflammation like no other method in the world. For severe edema or very significant inflammation, there's nothing better than dry fasting, but it should be supervised with a service dedicated to it and not necessarily clinics in the middle of the city. It should be in centers in the countryside where there's space to do this appropriately. So modesty is about staying humble. We don't understand everything, but we know we have results in many areas. Dry fasting has answers on all fronts of medicine, except perhaps for things like if you have a leaking aortic valve that needs repairing or stents need to be placed. In that case, maybe it's not the answer, and we shouldn't exaggerate its effectiveness on such matters, especially in cardiovascular medicine. However, if you consider anti-aging medicine and prevention is key. Dry fasting is number one if you want to age well and live out your life in good health. I don't know what it is, but it's the number one therapy. Sports medicine wanted to gain 3, 4, 5 years of sports. Top athletes should be interested in dry fasting to extend their careers and have fewer injuries. They would do this between seasons when they don't have inactivity. It would allow them to do a complete cellular reset, a regeneration, to rest, to repair tendons, joints that are tired so they can recover each year. It would be good. In the future, I would also say that in everything related to digestive medicine, liver, intestines, we really have the answers. We are pathology, there you go. Even in renal medicine, we have kidney recovery happening. It's related to everything in rheumatology, there you go. Here is everything related to geriatric medicine, everything related to gerontology. We truly have answers in all areas. In all aspects of medicine, even in emergencies, we could really have answers, provided we understand well what the person has, and in emergencies you might have a viral infection. Bacterial, I know it works very, very well, so during the pandemic we clearly saw that. Finally, etc., we could debate all these sectors and these topics. So the mucous membrane of the lower intestine will regenerate. So when you have the intestine that for some reason has increased permeability, it will eventually reconstruct itself. Afterward, you will have an intestine that is completely rebuilt and regenerated. And when your intestine is regenerated, the entire immunity within it is restored. So in essence, there are no chemical side effects, no dependency, no artificial suppression of the uterine system like with corticosteroids or immunosuppressants, which we've discussed. Therefore, you will stimulate your own internal resources, rebalance the uterine system, and restore the body's internal equilibrium. And you have a unique detoxification system. It's not necessarily magic, but all ancient traditions have spoken of fasting. So if we've known about this since time immemorial, why not bring it back to the forefront in a more significant way? Because here, well, there you go, there are 300 people watching these videos. It's peanuts. So I share this information with passionate people, but it's still surprising that only 300 people are interested in following these videos. These videos should be seen by millions of people. It should be something to consider before running to a doctor to take pills. Maybe it's about learning to occasionally skip an evening meal and even doing very short fasts, practicing a bit of autophagy, a bit of cellular cleansing to remove a little excess. It makes sense to remove rather than add, to take things rather than add more. But, well, there you go, it's still not there. We are focused on a disease paradigm rather than health, so the idea of dry fasting is to have a first-level therapy for maintenance and treatment. For those with a good lifestyle, I would say there's not necessarily a need for extensive preparation. If you have a diet with not too many carbohydrates and eat somewhat properly, the preparation can be done in 1 or 2 weeks. After that, it's always good to do a little cleansing beforehand, and all the solutions are in the book. There you go, doing very simple things. But if you have a very good lifestyle, dry fasting doesn't necessarily require extensive preparation. You can really quickly get started directly with dry fasting, and it works very, very, very well. So there you have it. This was a short video on the importance of immunity and dry fasting. Well, there you go. We have a first-rate response to all degenerative autoimmune diseases. And then don't wait for the disease to be established to start fasting. We like to see people who come for prevention. And it's clear that seeing people with pathologies, well, you have to recover things when there's a fire, there's an emergency. You have to recover with dry fasting. So there you go. At some point when you've gone too far, we see people arriving with terminal cancer. Don't think that after 10 or 15 years of a cancerous process, dry fasting will magically solve the problem. You have to think ahead and maintain your health. It's an investment, a savings plan for your life, for your retirement. So people who come for preventive treatment, well, that's the best thing to do. Instead of waiting to develop conditions and then reacting to the slightest symptom, don't hesitate to look into this method. You can always do very short sessions at home without any problem. However, make sure to do it properly, and then longer treatments are always more beneficial with guidance on the right dosages to ensure the therapy helps you achieve the best possible results and make the most of the treatment. If you're alone, it's always difficult to assess yourself. We don't know how to treat ourselves and always need a little help or advice. So, of course, I have never cured anyone. So, one must remain humble in medicine. Dry fasting is a therapy of self-regeneration, self-health, and learning about health, where one learns to know oneself, to live an experience from the inside out. It is a tool for inner healing. It's not the therapist, it's not me. We never heal, we don't heal others. We are really here to provide coaching, help, and support, which is also emotional. The real healing work is done by you. You are your own system of self-regulation and self-repair. We don't know the results you will have from the treatments. We can't know. We are not mediums. People come, they undergo their treatment, and we are here to ensure the person has the best possible treatment for them. As for the results, well, we don't know. We heal no one. We always say, doctors say, I healed so-and-so, I healed so-and-so. When someone tells me that they are here to heal people, it's rather worrying. So if a therapist tells you they want to heal you, I run away. We don't heal anyone. We can't. We are not responsible for the result that the person will have in a dry fast. We provide the maximum help, advice, and support, but we don't know what the outcome will be. That's all for this summer video. See you soon. Bye-bye.